Welcome back, everyone, to BBB Sharing. I'm Evie, Director of Ignite, sparked by BBB. We are here with Joshua.
Good morning, everybody.
Good morning. And a very special guest, Joe Moss from Virginia Medicare
Options.
That's right. Forgive me. I know it's Tuesday morning, but it feels like a Monday morning for me. Joe, thank you so much for coming in. I met you, or I'm meeting you for the first time today, but I heard about you through Leslie. And Leslie works in our office. She's new here, but she insisted that I email you to get you in here. So tell me a little bit about who you are, where you come from, and what you do.
Okay, thank you for having me this morning. Again, my name is Joe Moss, the company Virginia Medicare Options. And happy to be here to get a chance, especially at this time of the year. We're in the open enrollment season for Medicare, just like lots of group health people or people who have health care through their employer. A lot of times are making decisions about 2025 at this time of year. So the Medicare folks have to do that as well. It's going to be a big year of change for people with Medicare. CMS estimates anywhere from 40 to 50% of people this year may change their Medicare plan.
Really?
What's CMS?
Medicare, that's their formal name.
Oh, okay.
And Medicare is sort of a subset of Social Security. So they're all wrapped up together when you're first getting involved with Medicare, and it can be a confusing time for people. Some of them, a big surprise comes when they find out that they're 65. I've been working my whole life. I've been paying into Medicare and Social Security. And wait a minute, now you're telling me I have to pay something for Medicare? That's a big surprise to a lot of people. And for most folks this year, it's $174.70 per month. And then there may be additional costs beyond that depending on the pathway they choose to take with their Medicare.
So what made you decide that you wanted to go into this business?
I had been in insurance in general, different types of products for a number of years. And then my mom needed help with Medicare, so I started looking into it and learning about it. Prior to that, I didn't want anything to do with Medicare because it just confused the heck out of me like it does many other people. And many people don't know the difference between Medicare and Medicaid. And
I was going to ask. That was going to be my next question.
the waters get a little muddy. But Mom needed some help, so I started learning about it. And the next thing you know, I started finding some opportunities to help people with Medicare coverage. And now that's all I do. I'm exclusive with Medicare. I don't have time for anything else anymore because it keeps me pretty busy.
So what is the difference between Medicare and Medicaid?
Are we able to add Social Security on top of that? Because you said Social Security and Medicare, so I was very curious what the three have to do with each other and why.
Okay, well, when people, let's say they turn 65, they go to the Social Security website, which is ssa.gov, and at that point, they can choose to start accepting their Social Security if they haven't done so already, because they can start doing that at age 62. And if they have not yet done so, they can do that at 65. Some people hold off till they're 70 to start collecting their Social Security, or somewhere in between there. Medicare, you access from that same site in order to sign up initially as well.
Okay.
And some people may already have their Part A because they're working and getting their health insurance through their employer. They want to hold off on that Part B because that's what costs you $174.70, which will probably go up a little bit next year, as it often does. They haven't announced that new price yet. Medicare can get pretty complicated, but Medicare is health care primarily for seniors. Some people can get it at a younger age if they have certain medical conditions. And Medicaid, on the other hand, if you think of the CAID part of that, aid is the last three letters, AID. So that's aid in most cases to low-income folks for all types of things. Some of it's medical. It may include lots of other types of aid.
Okay. Yeah, every time I just see the commercials come up, I can kind of tell it's not for me just because of I see a lot of old people on there and I'm like, I can worry about this later, but it's always good to know.
No, it's a good question, and it is a confusing topic, and that's one of my goals with my company is let's break it down to the basics and really make sure that people understand the nitty-gritty, and I get into the weeds with folks. Most of the time I encourage them to meet face-to-face. I think people can communicate sometimes a little better that way. Not that this isn't a good form of communication, because it is, but face-to-face sometimes you get a little more nuance and a little more input from folks. And I think they're pretty relaxed when they're at their own kitchen table and talking about this huge thing of Medicare that's going to impose on their lives.
Oh, for sure.
One of the things that I talk with folks about is that there are two main pathways that most people are going to have to choose from when they get into Medicare. If you have original Medicare and those two parts, A and B, which is your hospitalization and then your other medical expenses, when you get into original Medicare, Medicare only pays 80% of most expenses. So now you have that 20% gap. So there's a product called Medigap that insurance companies sell. They also call it a supplement, and that will cover the 20%. There's a lot of other details, but in general, that's what that pathway can do for you if you choose a supplement path. Very good coverage, very little, if anything, out of pocket after people get set up with that. But they'll pay a monthly premium for that supplement that's going to cost or pay for that 20% for them. The other main pathway is what we see a lot of times on TV. Josh, you talked about all the commercials and how it may not apply to you.
It goes right over my head when they start talking about numbers.
Tune it out or change the channel, but when you're about 60, 63, somewhere in there, start listening a little more carefully. Lots of commercials, and in some cases they're a little confusing from the fact that some of it's addressed more to people who do have Medicare and Medicaid, and they'll say, you may be able to get this and this and this, hearing and dental and vision and all these other things. But the plans have gotten better and better. They're called Medicare Advantage plans, and they have improved quite a bit over the last several years. And every year, those insurance companies are competing for your business, which is why you see so much of it on TV, I guess. And they keep dangling these shiny silver objects out in front of people's faces and say, hey, guess what we have this year? So they've added in the past few years things like a grocery benefit. They've added an over-the-counter benefit, those things so that the cost is coming from the insurance company and not from your pocketbook as much. So in a time when we've had some inflation, the grocery benefit, the over-the-counter benefit can be very helpful. Most of the plans, too, have added a dental component. They have a hearing component, so you get some money maybe for hearing aids if you need that. So they've improved a great deal. Medicare Advantage, I think Medicare pushes a little bit more so than the supplement side. They do believe that Medicare Advantage offers more of an integrated opportunity. You're going to be in a network with hospitals, pharmacies, doctors, specialists who can see everything about you and your history and whatnot. So it's a better managed care program according to Medicare. Me, I don't care which pathway that people choose. If they like the supplement pathway, I'm happy to help them with that. If they like the Medicare Advantage, which is a more all-inclusive piece where it will include the dental, the vision, the prescription plan, which is huge. Okay. That's one other thing I should probably comment on is the prescription plan, because we had a thing called the Inflation Reduction Act that occurred, I think, just a little over a year ago now. And that included something that I've been clamoring for and hoping for many years. You would often hear politicians talking about Medicare and why Medicare costs for prescriptions were so expensive. Why can you get them cheaper in Canada or Mexico or whatnot? Well, from the time it was conceived, Medicare has not been able to purchase drugs directly from the pharmaceutical companies, despite the fact that they're the largest purchaser of pharmaceuticals in the world. So the way Congress had it set up, there were extra layers of cost built in that cost you and me and everybody else more money if we have to get medications. So this Inflation Reduction Act was a giant step toward helping to improve that situation in a couple of ways. Some specific expensive drugs will start to come down over the next few years. Not as many as I'd like to see, but it's a start. The other thing they've done for 2025 is they've gotten rid of this awful thing called the donut hole, and they've also, yay, I can hear people in the background saying, yay, but they've also lowered everybody's maximum cost for prescriptions to $2,000 per individual for 2025.
What was it originally?
Well, there really wasn't one going back 2 years ago. The current year got lowered to $8,000. But I had a friend I was talking to the other day who 2 years ago paid $13,000 and change for his medications. So when he found out it was only going to be $8,000 for the current year, he was thrilled. When I called him and told him it was only going to be $2,000 for 2025, he was screaming, "Hey, I got a raise, I got a raise." So very happy to keep more of that money in his pocket. So the consequence of that, though, is yet to be seen and felt, I think, because I think the insurance companies, and we're seeing it in certain ways already with the new plans for 2025 that I've seen, they're having to adjust their formularies, their lists of drugs somewhat, because they can see that Congress has tinkered with some of those medications, as I stated earlier. And maybe there's a product that they have provided on their formulary in the past that was a big loser for them in 2024. I'm not sure what the reason is, but we're seeing some drugs that are not going to be available in 2025. It's not a huge, widespread thing. I don't want to scare anybody, but we're seeing some adjustments there, and that's why I think Medicare feels like they're going to see a lot of people have to change plans. I've seen some discontinued plans, too, for 2025 that have been readily available in the past that will not be available next year. So that concerns a lot of people, and I'm scrambling around with some clients now trying to find them a good product to take the place of what they've lost.
I think I was having a conversation with one of our team members, and she was talking to me about her doctor. Her previous doctor just retired, and she has a new doctor, and she put her on this new medication only because her insurance only pays for her to take her medication once a day, but she needs to take it twice a day. And she said, yes, but if you put in a request, they'll let me take it twice a day. They'll pay for me to take it twice a day. And I think part of that for her is not wanting to change her prescription, but what does that have to do with, and correct me if I'm wrong, but does that have to do with the manufacturing of the drug that's gone up, or the fact that they just don't want to reduce the price of what it actually costs to sell it and still make a market price from it, than, lowering it for people to be able to still have access to that medication?
Well, Medicare has put limits on certain drugs. Opioids are a great example where they've been very, I don't want to say heavy-handed. They've come in and made some mandates about things that needed to be addressed to limit how many of those types of drugs people can have. But there are a lot of drugs where the common dosage may only be one a day, and so that's the standard they've established. I don't remember ever speaking with an individual who needed an exception from the insurance company that didn't get it. If their doctor says, my client needs it for this reason, and typically they have to fill out a form or write a letter, then the insurance company grants that exception. So I don't see that as a huge problem for most folks.
What you said confirms what she said her previous doctor did.
Okay.
But the new one, I guess, said her response to her was it keeps getting rejected. And she said, well, you're not submitting it and letting them know based off of my medical records that I need to take it twice a day. So I just wanted to make sure that was.
Very good. You mentioned about doctors too, and that's a good topic that seniors encounter because we just don't have enough doctors. Mm-hmm. We're seeing some primary care doctors be replaced by nurse practitioners who also have to, I think, some certification there for them to be considered as a primary care doctor. But we're seeing more of them come into the marketplace. We need more young ladies out there. Nursing's a great job. Please get into it. And from what I understand there, too, there's a problem that there aren't enough teachers teaching in available spaces for people to learn about becoming a nurse. So lots of problems in our society, but I think we're addressing some of them, and Medicare certainly is with this Inflation Reduction Act.
Well, how can people get in touch with you?
Easiest way is a phone call or a text. Phone number is 804-339-4605. And my name again is Joe Moss, and I am big on wanting to help educate people and make sure they understand what their options are and help them see what's available to them and then make a choice that meets their needs.
Thank you so much, Joe, for coming in here to talk to us.
Thanks for having me.
Of course.
Thank you, Joe.
Josh, thank you as well for joining us, too.
Of course. It's always a pleasure.
Everyone that's watching on YouTube, please make sure to like, share, subscribe, and comment down below. It really helps the algorithm out. Please make sure to also look up the right BBB on YouTube. I know it gets confusing. It's BBB Central VA, and we are BBB Sharing on Spotify. So make sure to follow us and like us. Thank you.